The Aldis podcast is brought to you by Aldis International, supplying your expert AI and digital transformation staffing needs across the US and Europe. Today, you are listening to our AI in Action series, where leading minds in AI from across the world share their story, success, and advice. AI in Action cuts through the hype and explores the true impact of artificial intelligence in our world today.
You're listening to AI in Action. I'm your host, JP Valentine. Our guest today is Jonah Leshin. Jonah is the head of privacy research at Datavant. Jonah, welcome to the show.
Thank you. It's great to be here.
Yeah, we're delighted to have you. So, Jonah, let's start with yourself, please, as we do with all of our guests. Could you give us an overview of your journey in technology, from where you got started, some of the roles you've held along the way, and take us up to today as the head of privacy research at Datavant?
So I started my journey in academia. I got my PhD in math, and I really enjoyed studying math and still do when I have the opportunity to do. But shortly after my PhD, I really saw the range of opportunities in data science. So the theory side, the software/implementation side, the business and user side, and also the ubiquity of the industries where data science was becoming more impactful. And so I really liked the variety of ways to potentially get involved and contribute. And so shortly after my PhD, I transitioned into industry. I joined startups in the Boston area for several years. This really gave me the opportunity to take an interest in the business and product side and also the team building side, as opposed to just the more theoretical side that I was previously exposed to in my academic career. And so I worked in a few startups in the Boston area. Most recently, before joining Datavant, I co-founded a company called Highland Math, which was focused on data monetization. And then in August of 2020, we were acquired by Datavant, which brings me to where I am today.
Amazing. Thank you so much. We've been fortunate enough to have someone from Datavant on the show previously, but for people who may not have caught that episode, could you please give us a high-level overview of who Datavant are as a business, what you do, and the mission of the organization?
Yeah, so at a high level, Datavant's mission is to connect the world's healthcare data. So one of the main obstacles in gaining value out of healthcare data today is its siloed nature. So this is understandable due to the sensitivity of the data, but there's enormous amounts of utility to be unlocked if entities are able to exchange data in a compliant way. And so when we think of exchange of data, we're really thinking about all forms. So this could range from I'm a patient and I want to pull my record from my healthcare provider, all the way to I'm a healthcare analytics company and I want to model certain healthcare outcomes and I need some lab data in order to do that. So Datavant is building technology to enable this exchange of healthcare data.
Super helpful. So talk to us about your role. Obviously, head of privacy research is a broad term, your background being data science. So can you describe what the main responsibilities of your role is and how that works in conjunction with the broader data science team beneath you?
So my role in head of privacy research within the Privacy Hub function within Datavant. So I mentioned Datavant's mission being to connect the world's healthcare data. And so critically, it's important to do this in a privacy preserving way. And so Privacy Hub is a function within Datavant whose mission is to ensure that the data that Datavant is connecting is being exchanged in a way that is not compromising patient privacy, but also allowing for utility. So to give an example, one way to protect patient privacy in healthcare data is via de-identification of that data. And this has a statistical element to it. So we basically want to prevent the triangulation of the data that would enable one to infer a patient's identity. So as an example, if I know your zip code and your date of birth, I may be able to find out who you are. But if I only know your zip code and your year of birth, that's much less likely. That's an oversimplified example, but these are the type of operations and considerations that can come into play when you're thinking about whether a data set should be considered de-identified. And there's specific guidance on this in HIPAA law. So there's a privacy risk element in terms of data analysis that I just spoke to. And there's also a technology element in terms of how one can efficiently evaluate a large data set when it comes to privacy, and then how one can operationalize the necessary changes to the data that need to be made in order to make that data de-identified, which enables it to be shared in a compliant way. And so there are compute questions, there are security questions, and it's really an endeavor that touches upon engineering and data science. In terms of my role in particular, I manage our research groups that are advancing risk assessment principles and looking at privacy in the context of new healthcare use cases and emerging technologies. Give an example of this, we can think about genomics data. So genomics data is becoming extremely valuable for research use cases. To take an example, there are predictive models being developed looking at different genotype combinations, what those combinations might imply in terms of actual expression of certain diseases. But there are also privacy considerations with genetics data, given what kind of the detail that it can give about a person's identity and the sensitivity of that information, along with the fact that there's more and more genetic data coming online that's potentially linkable to other public data sets, which could be a privacy concern. Another example of something one of our research groups is focusing on is unstructured data. So the majority of healthcare data that exists today is unstructured, meaning that it could be free text doctor's notes, could be imaging. We can contrast this with structured data where you may have a CSV where you know that in column 1, I'm going to have patient name. In column 2, I'm going to have patient zip code, healthcare provider, et cetera. And that type of data is easier to assess, easier to de-identify. Unstructured data, it really, NLP comes into play where we're thinking about entity recognition, redaction, and then being able to make a both qualitative and quantitative assessment as to the privacy risk of that data. So there are several of these research groups within Datavant, and my role is to work with them on the research itself, prioritization, coordination with product and engineering as we advance the frontier of privacy.
Jonah, you and I were talking off air about the last 12 months at Datavant in particular, and how you guys have been very focused on assembling a team. It's a lean team, but you've been strategically growing and continuing to add talent. Could you describe the current makeup of the overall data team, from the positions that exist, the size of the group, and what it's like day to day, not just for your group in privacy, but the broader data team, just to give our audience a look behind the scenes?
Yeah, sure. So we have data scientists in a couple of different functional areas. We have data scientists who are within our engineering org and are working on hands-on product development. And then we have data scientists in the privacy hub org that I'm in, who are the privacy experts, focused more on the statistical analysis, which are upstream of the actual product implementation. And so in the former case, we have a handful of data scientists embedded within our engineering pods. And in the latter case, we have 25 or so privacy experts on our privacy hub data science team. And those 25 folks are mostly in these research groups that I mentioned. A research group may have anywhere from, say, 3 to 8 team members working on these projects, in addition to focusing on actual client work where we're working with real client data sets, applying the principles that we've researched in our research groups, and able to do privacy assessments for the clients who are looking to exchange data through Datavant's ecosystem.
You are listening to the Aldis podcast. When you're looking to scale your team, or if you are interested in showcasing your company in a future episode, reach out today. Or if you're in the market for a new role, visit our website to view open positions, www.aldis.com.
Something you mentioned earlier, Jonah, which I want to come back to, was the new use cases for data, whether it be in genomics for research. Broadly speaking, when you look at the landscape of the exciting things happening within data science, AI, in the biotech space, what are some of the things that you're most excited about to see come to fruition, whether it's the work you're doing at Datavant or impact on the industry as a whole?
One thing at Datavant that I'm really excited about here is privacy preserving record linkage. So, how you connect disparate patient records that are already de identified. So, de identified data is going to be easier to exchange in the sense that you don't need to have certain legal documents in place, such as a business associates agreement that has to be signed by both parties to share identified data. So de-identified data is really becoming the way that a lot of use cases are being served. And so when we talk about privacy preserving record linkage, we want to be able to take patient records from dataset A and link them to patient records in dataset B. So an example here you can keep in mind is continuity of care. So if you are switching from an original provider to a new provider, you may very well want to have a coherent and accurate prescription history. But if you can link a patient's record from their original provider to their new provider, then you may not end up with the right prescription history. And this is something that's clearly important for offering care to a patient. So there are current methods in play that use machine learning, that make model choices based on data that is available, that make use of what are called referential data sets, which are ground truth data sets that may have information such as a patient's previous address versus future address. Those are changes that would not otherwise be known in terms of a patient moving from one location to the next. That's only going to be available in a ground truth data set. So there's an element of data engineering that comes into play. There's machine learning that comes into play. And it's a problem that we're solving at Datavant in terms of enabling this sort of record linkage to be done in a way that is accurate and also a way that preserves privacy. And the fact that we're doing this on de-identified data really enables the privacy preservation here.
So, Jonah, I want to put into context the journey that Datavant has been on since it launched and how that's going to impact the next few years ahead, what the next few chapters look like. Datavant is obviously an organization which was spun out of the Royavant family of organizations who are renowned for being very successful. Datavant has certainly been following that trend since it launched in 2017. When you look at the business today and you look at the project roadmap, the things that you're working on, can you talk to us about where you see the business being in a year or two from now, what you're most excited about, and what impact that's going to have on the needs to continue to bring in talent and add to the headcount?
Yeah. So there are a few areas where we really want to advance healthcare data exchange over the next year. So the most important thing for us is being able to make these exchanges of healthcare data done in a way that is more modern and efficient and accurate when it comes to using technology. We want to be able to enable a patient to request their own data and to be able to have that record come back quickly and reliably. We want a research function in the university to be able to link data sets together in a way that is seamless and doesn't involve manual review of thousands of records, multiple requests to the data sources. So being able to effectively bring healthcare data exchange online and out of the world of kind of fax machines and manual requests is going to be critical. And I touched upon some technologies that are coming into play when it comes to privacy preservation. And so being able to incorporate those into our workflows with healthcare data exchange is also going to be critical. So as we develop more standardization around the way that privacy preservation is currently done when it comes to de-identification of healthcare data, we want to be able to more broadly solve the problem of I'm a data recipient. I want the right sources of data to work with. I want to be able to do this in a privacy compliant way. Datavant, what are the solutions that I should look for here in terms of that connectivity? And that could be connecting with multiple data sources via multiple technologies. And so when it comes to our team, we're really going to be looking to grow our expertise in terms of technological innovation when it comes to folks with backgrounds working in encryption, working in natural language processing, and then ultimately strong generalists who are able to learn and grow on the fly in terms of developing a range of data science skills.
Jonah, final question for me then, staying on the topic of the people and the environment at Datavant. As someone who's a senior leader within the business, you're heavily involved in shaping the strategy and also headcount planning. So when you're speaking to candidates about Datavant, the environment, the culture, the mission, what is it that you tell them that gets these candidates excited enough to join Datavant over some of the other great companies currently hiring?
Yeah, so I'd say there are a couple things. When I speak with candidates, there are three things that I typically speak to. The first is the people on the team. I feel like at Datavant, we really invest in our team members in terms of growth, in terms of challenging them, giving them ownership, and then being respectful, nice colleagues. Second thing I would mention is the trajectory of the company. We've had a lot of success growing over the past several years, broadening our health data ecosystem with respect to both data sources and data recipients. And then the third is the mission of the company. So connecting the world's healthcare data really is a noble mission to ultimately improving healthcare outcomes. I think we're miles away in terms of being able to use healthcare data to its fullest potential. So those three reasons are the core basis for why I'm at the company and why I would encourage folks to apply and join us.
Jonah, thank you so much for coming on today and talking to us. Really great to learn about your journey to where you are today at Datavant. A great continued look into the amazing work that Datavant is doing and why it's such an attractive place for people who want to work within AI and data but have an impact in the industry. And great to hear about the outcome of the year ahead. So we appreciate your time. Thanks so much for coming on the show, and we look forward to having you back on the show again in the near future.
Thank you for having me.
Thanks for listening to this episode of the Aldous Podcast. If you enjoyed today's episode, don't forget to subscribe, rate, and review. We are available on Apple Podcasts, Spotify, and any Android podcast of choice. You can also head over to our website, www.aldous.com, to listen to more podcasts, view our open roles, and stay up to date with industry news. Thanks for listening, and stay tuned for more great episodes coming very soon.